Hi, I'm Dr. Demetrio Aguila. I'm really excited to announce the introduction of Tula, tubes under local anesthesia. So when children come in and they have problems with their eustachian tube, the traditional way to treat that is with a small tube that goes right here in the eardrum, and it allows that fluid to drain out because this eustachian tube isn't functioning properly and we need some way in order for that fluid to get out. Typically, once a child has had significant enough ear infections that it's starting to cause problems with their hearing or potentially problems with speech development, then we start to get concerned about preventing significant problems with speech delays, and that's the reason for putting in tubes. Imagine that now you've got a 6-month-old or 12-month-old or a 2-year-old who is grumpy because they're hungry and they don't really understand why they can't eat. You then have to take that child away from his or her parents in order to undergo the procedure. And so that can be really scary and it can be very traumatic for the child. And our practice is one of the first 11 in the entire United States which will be offering this procedure. It's a new procedure which just recently got FDA approval. The process of putting in the tubes is relatively straightforward. What makes this procedure different is how we keep the child comfortable and safe during the procedure. So the procedure involves putting in a numbing agent in the ear canal. We put some drops in there, and then we put in a special earplug in the ear, which is connected to a little battery-driven device. And what that battery-driven device does is it changes the electrical potential across the membrane, the eardrum, okay? And it makes it easier for the local anesthetic, the numbing agent, to get into the eardrum and numb up the eardrum so that the child can be comfortable. This all happens with your child sitting in your lap, comfortable and ready to go. It's easy, it's simple, and it's affordable. You don't have to go to the operating room, so you don't have to pay for the use of the operating room, what we call the facility fee. It's done under local anesthesia in the office, so you don't have to pay for what's called the anesthesia fee. Typically, those two fees together can account for up to 90% of the cost of a procedure. Our practice is the first one in this region of Nebraska and one of the first 11 in the entire country to offer this groundbreaking approach to ear problems.